Section 7. Somatoform disorders. 1. Blank are a group of psychiatric disorders in which the patient has persistent somatic complaints that can't be explained by a physical disorder. A. Somatoform disorder. B. Panic disorder. C. Anxiety disorder. D. Depressive disorder. The correct answer is A. Somatoform disorder. 2. Which of the following disorders was formerly known as a psychosomatic disorder? A. Somatic disorder. B. Synaptic disorder. C. Somatoform disorder. D. None of the above. The correct answer is C. Somatoform disorder. 3. Somatoform disorder accounts for about blank of primary care patient visit. A. 2%. B. 5%, C. 10%, D. 15%. The correct answer is B. 5%. Which of the following is a major type of somatoform disorder? A. Synaptic disorder. B. Somatic disorder. C. Pain disorder. D. All of the above. The correct answer is C. Pain disorder. 5. Blank refers to the conversion of emotional or mental states into bodily symptoms. A. Somatization. B. Synmatization. C. Emotional conversion. D. Mental state conversion. The correct answer is A. Somatization. 6. Which of the following is true about somatoform disorders? A. Body dysmorphic disorder is a simple disturbance in a person's image. B. In patients with hypochondriasis, the primary emotional feature is fear. C. In pain disorder, no medical evidence of a pathologic process exists. D. Most types of somatoform disorder affects more females than males. The correct answer is D. Most types of somatoform disorder affects more females than males. 7. Many patients with somatoform disorder also have blank. A. Personality disorder. B. Depressive disorder. C. Anxiety disorder. D. All of the following. The correct answer is D. All of the following. 8. Blank view psychosomatic symptoms as responses that the patient has consciously learned and subsequently maintains because they bring some type of reward. A. Psychobiologic scientist. B. Behavioral theorist. C. Social theorist. D. Psychoanalyst. The correct answer is B. Behavioral theorist. 9. Which of the following is a psychobiological mechanism at work in somatization? A. Heightened body sensation. B. Increased autonomic arousal. C. Perceived need to be sick. D. All of the above. The correct answer is B. Increased autonomic arousal. 10. During the treatment and evaluation of somatoform, which of the following should be done? A. Referral should be carried out as often as needed to ensure adequate care is given. B. Patient should undergo a thorough physical workup. C. Other psychiatric disorder that resembles somatoform should be ruled out. D. All of the above. The correct answer is A. Referral should be carried out as often as needed to ensure adequate care is given. 11. In blank, speech rhythms are abnormal, with repetitions and hesitations at the beginning of words. A. Oral dysfunction. B. Speech dysfunction. C. Stuttering. D. Oral encopresis. The correct answer is C. Stuttering. 12. In blank, the child calmly rises from bed in an altered state of consciousness and walks about with no subsequent recollection of dream content. A. Sleep terror. B. Sleepwalking. C. Visual hallucination. D. Visual illusion. The correct answer is B. Sleepwalking. 13. About blank of stutterers recover after age 16. A. 5%. B. 20%. C. 60%. D. 80%. The correct answer is D. 80%. 14. Which of the following is true about stuttering? A. It can lower a child's self-esteem. B. It can be associated with mental dullness. C. It is most common in children of superior intelligence who fear they can't meet the expectations of socially thriving families. D. All of the above. The correct answer is D. All of the above. 15. In blank, the child awakes terrified, in a state of clouded consciousness, and often unable to recognize familiar surroundings. A. Sleepwalking. B. Visual illusion. C. Sleep terror. D. None of the above. The correct answer is C. Sleep terror. 16. Blank is characterized by intentional or involuntary voiding of urine, usually at night. A. Functional enuresis. B. Functional urinal. C. Functional encopresis. D. Functional wetting. The correct answer is A. Functional enuresis. 17. Bedwetting occurs in blank of males to age 18. A. 20%. B. 10%. C. 5%. D. 1%. The correct answer is D. 1%. 18. Bedwetting may be linked to which of the following conditions? A. Parental divorce. B. Faulty toilet training. C. Hospitalization. D. All of the above. The correct answer is D. All of the above. 19. Blank is the evacuation of feces into the child's clothes or inappropriate receptacles. A. Functional enuresis. B. Functional encopresis. C. Bedwetting. D. Stuttering. The correct answer is B. Functional encopresis. 20. The most effective treatment for somatoform disorder is blank. A. Cognitive and behavioral therapy. B. Psychoanalysis. C. Insight-oriented psychotherapy. D. Medication. The correct answer is A. Cognitive and behavioral therapy. 21. Which of the following therapies may reduce pain? A. Medication. B. Hydrotherapy. C. Homeopathic therapy. D. All of the above. The correct answer is D. All of the above. 22. In blank, the patient is preoccupied with an imagined or slight defect in physical appearance. A. Functional encopresis. B. Functional enuresis. C. Body dysmorphic disorder. D. Conversion disorder. The correct answer is C. Body dysmorphic disorder. 23. Most body dysmorphic disorder perceive flaws in their blank. A. Skin. B. Nose. C. Hair. D. All of the above. The correct answer is D. All of the above. 24. Which of the following is true about body dysmorphic disorder? A. It occurs in about 20% of the population. B. It affects more males than females. C. It frequently goes undiagnosed. D. All of the above. The correct answer is C. It frequently goes undiagnosed. 25. The average age of onset of body dysmorphic disorder is blank. A. 10, B. 17, C. 30, D. 50. The correct answer is B. 17. 26. Many patients with body dysmorphic disorder may have which of the following psychiatric disorders? A. Depression. B. Eating disorder. C. Agoraphobia. D. All of the above. The correct answer is D. All of the above. 27. According to blank, low self-esteem may contribute to body dysmorphic disorder. A. Behavioral theory. B. Cognitive theory. C. Psychological theory. D. Biological theory. The correct answer is C. Psychological theory. 28. Which of the following is a symptom of body dysmorphic disorder? A. Patients are anxious and self-conscious. B. They are self-absorbed. C. They have low self-esteem. D. All of the above. The correct answer is D. All of the above. 29. Body dysmorphic disorder may be misdiagnosed as which of the following? A. Pain disorder. B. Trichotillomania. C. Hypomania. D. Mania. The correct answer is B. Trichotillomania. 30. To assess the severity of BDD, body dysmorphic disorder, the doctor may use which of the following instruments? A. Schneider Disability Profile. B. Psychiatric Questionnaire. C. Hamilton Disability Profile. D. All of the above. The correct answer is A. Schneider Disability Profile. 31. Treatment of body dysmorphic disorder seeks to blank. A. Enhance beauty. B. Carry out surgery where needed. C. Eliminate harmful effects of compulsive behaviors. D. All of the above. The correct answer is C. Eliminate harmful effects of compulsive behaviors. 32. Aversion therapy is an example of blank. A. Cognitive therapy. B. Behavior therapy. C. Medication. D. Biological therapy. The correct answer is B. Behavior therapy. 33. In blank, a painful stimulus is applied to the patient to create an aversion to her obsession with the perceived defect. A. Biological therapy. B. Behavior therapy. C. Aversion therapy. D. Cognitive therapy. The correct answer is C. Aversion therapy. 34. Blank breaks the habit of thinking about disturbing thoughts by interrupting them and substituting it with competing ones. A. Thought stopping. B. Aversion therapy. C. Flooding. D. Reinvention. The correct answer is A. Thought stopping. 35. To replace obsessive thought, the patient may be taught the technique of blank. A. Thought stopping. B. Thought replacement. C. Thought exchange. D. Thought reversal. The correct answer is B. Thought replacement. 36. Blank aims to prevent compulsive behavior through distractions or redirection of activity. A. Thought blockage. B. Thought stopping. C. Response prevention. D. Thought switching. The correct answer is C. Response prevention. C. Flooding is also called blank. A. Aversion therapy. B. Implosion therapy. C. Prevention therapy. D. Thought snapping. The correct answer is B. Implosion therapy. 38. Blank exposes the patient to images of her perceived flaw for prolonged periods until they no longer cause distress. A. Flooding. B. Response prevention. C. Thought replacement. D. All of the above. The correct answer is A. Flooding. 39. Which of the following nursing interventions is appropriate for a patient with body dysmorphic disorder? A. Provide an accepting, non-judgmental atmosphere. B. Listen attentively, offering feedback. C. Engage patients in activities that create positive accomplishment. D. All of the above. The correct answer is D. All of the above. 40. Blank is marked by the persistent conviction that one has or is likely to get a serious disease. A. Anxiety. B. Hypochondriasis. C. Hamilton depression. D. Conversion disorder. The correct answer is B. Hypochondriasis. 41. Hypochondriasis accounts for about blank of psychiatric patients. A. 5%, B. 15%, C. 20%, D. 50%. The correct answer is A. 5%. 42. Which of the following is true about hypochondriasis? A. It can lead to psychological distress. B. It affects more women than men. C. It's most common between the age of 40 to 50. D. All of the above. The correct answer is A. It can lead to psychological distress. 43. Which of the following is a factor that contributes to hypochondriasis? A. Death of a loved one. B. A history of serious illness. C. Family member or friend with a serious illness. D. All of the above. The correct answer is D. All of the above. 44. Which of the following is often misinterpreted as a sign of organic disease? A. Borborygmi. B. Headache. C. Liver disease. D. Kidney disease. The correct answer is A. Borborygmi. 45. Which of the following is a sensory symptom often reported by patients with hypochondriasis? A. Tremors. B. Paralysis. C. Blindness. D. Headache. The correct answer is C. Blindness. 46. Which of the following is a common motor symptom complaint reported by hypochondriasis patients? A. Deafness. B. Weakness. C. Tunnel vision. D. Blindness. The correct answer is B. Weakness. 47. Up to blank of patients with hypochondriasis later develop organic disease. A. 30%. B. 40%. C. 50%. D. 60%. The correct answer is A. 30%. 48. Blank uses psychodynamic principles to help the patient understand unconscious conflicts. A. Group therapy. B. Interventions. C. Individual psychotherapy. D. All of the above. The correct answer is C. Individual psychotherapy. 49. Blank focuses on improving family members' awareness of their interaction patterns and on enhancing their communication with each other. A. Group therapy. B. Family therapy. C. Support group. D. Intervention. The correct answer is B. Family therapy. 50. Which of the following helps the patient improve her social skills? A. Group therapy. B. Intervention. C. Individual psychotherapy. D. All of the above. The correct answer is A. Group therapy. 51. In blank, the patient complains of persistent pain, which results from psychological factors. A. Body dysmorphic disorder. B. Hypochondriasis. C. Pain disorder. D. Depression. The correct answer is C. Pain disorder. 52. Which of the following is true about pain disorder? A. The prevalence of pain disorder is unknown. B. It affects more females than males. C. It is more common among the blue-collar workers. D. All of the above. The correct answer is D. All of the above. 53. Which of the following disorders commonly overlaps with pain disorder? A. Substance dependence. B. Anxiety. C. Depression. D. All of the above. The correct answer is D. All of the above. 54. According to blank, a patient with pain disorder converts unconscious conflicts to pain symptoms. A. Psychological theories. B. Biological theories. C. Cognitive theories. D. Social theories. The correct answer is A. Psychological theories. 55. Which of the following should not be used as a form of treatment for pain disorder? A. Anxiolytics. B. Tricyclic. C. Placebos. D. All of the above. The correct answer is C. Placebos. 56. Which of the following is a supportive measure for pain relief? A. Hot or cold packs. B. Distraction technique. C. Transcutaneous electrical nerve stimulation. D. All of the above. The correct answer is D. All of the above. 57. Which of the following therapy uses whole foods and controlled fasting to treat disease and maintain health? A. Herbal therapy. B. Nutritional therapy. C. Hydrotherapy. D. Physical therapy. The correct answer is B. Nutritional therapy. 58. Blank are dilute preparations of natural substances that in large amounts cause certain symptoms, but in small amounts may relieve them. A. Hydrotherapy. B. Homeopathic solutions. C. Naturopathic manipulative therapy. D. Herbal therapy. The correct answer is B. Homeopathic solutions. 59. Naturopathic manipulative therapy may include which of the following? A. Massage. B. Ultrasound. C. Diathermy. D. All of the above. The correct answer is D. All of the above. 60. Blank is marked by the loss of or change in voluntary motor or sensory functioning that suggests a physical illness but has no demonstrable physiologic basis. A. Conversion disorder. B. Somatization disorder. C. Mild pain disorder. D. Acute pain disorder. The correct answer is A. Conversion disorder. 61. Which of the following is true about conversion disorder? A. It can impede the patient's normal activities. B. It is common among the general population. C. It is life-threatening and has a short duration. D. It affects both females and males equally. The correct answer is A. It can impede the patient's normal activities. 62. Blank is a condition in which a patient deliberately produces symptoms of a physical or mental illness to assume the role of a sick person. A. Conversion disorder. B. Factitious disorder. C. Somatization disorder. D. Hypochondriasis. The correct answer is B. Factitious disorder. 63. Patients create fake symptoms by doing which of the following? A. Taking hallucinogens. B. Contaminating urine samples with blood. C. Injecting themselves with bacteria. D. All of the above. The correct answer is D. All of the above. 64. Factitious disorder with physical symptoms is also known as blank. A. Munchausen syndrome. B. Psychological symptoms. C. Conversion syndrome. D. None of the above. The correct answer is A. Munchausen syndrome. 65. In blank, the person intentionally produces a physical illness in another person. A. Proxy factitious disorder. B. Munchausen syndrome by proxy. C. Conversion transfer syndrome. D. Somatization disorder. The correct answer is B. Munchausen syndrome by proxy. 66. Which of the following is true about conversion disorder? A. It usually begins in adolescence. B. It is the most common somatoform disorder in children. C. Conversion disorder is rarely chronic. D. All of the above. The correct answer is D. All of the above. 67. Blank explains conversion disorder as a defense mechanism that absorbs and neutralizes the anxiety evoked by an unacceptable impulse. A. Psychodynamic theory. B. Biological theory. C. Psychological theory. D. Social theory. The correct answer is A. Psychodynamic theory. 68. Which of the following is a conversion disorder symptom? A. Pseudoseizures. B. Urinary retention. C. Aphonia. D. All of the above. The correct answer is D. All of the above. 69. Which of the following treatments is the most used for treating conversion disorder in children or adolescents? A. Behavior modification. B. Family therapy. C. Biofeedback training. D. Hypnosis. The correct answer is B. Family therapy. 70. Blank is a type of psychotherapy that uses barbiturates to induce release of suppressed thoughts. A. Hypnosis. B. Behavior modification. C. Narcoanalysis. D. Relaxation therapy. The correct answer is C. Narcoanalysis. 71. Blank is characterized by multiple and often vague physical complaints that suggest a physical disorder but have no physical basis. A. Somatization disorder. B. Conversion disorder. C. Factitious disorder. D. Vague disorder. The correct answer is A. Somatization disorder. 72. Which of the following is true about somatization disorder? A. It affects more females than males. B. Symptoms begin before age 30. C. It coexists with other psychiatric conditions like depression. D. All of the above. The correct answer is D. All of the above. 73. Which of the following is an important clue to help diagnose somatization disorder? A. Sensitivity to physical sensation. B. Complicated medical history. C. Feeling of depression. D. None of the above. The correct answer is B. Complicated medical history. 74. Which of the following nursing interventions is appropriate for a patient with somatization disorder? A. Gently inform the patient that her symptoms are imaginary. B. Keep in mind that your goal is to eliminate the symptoms. C. Negotiate a plan of care with input from the patient and, if possible, her family. D. All of the above. The correct answer is C. Negotiate a plan of care with input from the patient and, if possible, her family. Section 4. Schizophrenic disorders. 1. Which of the following is a sign of schizophrenia? A. Withdrawal from reality. B. Illogical thinking. C. Delusions. D. All of the above. The correct answer is